Welcome to Stay Alive and Fit with Liz Goodman, a new innovative radio show that taps into what's happening now in the medical industry, featuring fitness experts, foodies, and medical professionals from Tenet Health, with breaking medical news from David DePino. Get it right here and be an active participant in your health. Mixed messages about what is best for your health can make you feel like you're on a runaway train. So hop on and have some fun while Liz navigates this medical mystery ride. Call 888-565-1470 and ask Liz, your source for the latest medical technology and long life advice. All aboard. Here's Liz Goodman.
Hi, and welcome to Stay Alive and Fit. I'm your host, Liz Goodman. Ask me the questions to all your fitness and medical questions. I'm not a doctor or a nurse, and the sight of blood makes me squeal. But I'm an ordinary gal trying to navigate through the maze of all the ways I can stay fit, focused, and fabulous at almost 50. And like I say every week, there's always a debate with my friends as to whether or not I'm actually almost 50. I'm turning 49 in September, so to me as a woman, that's pretty darn close. So, the whole point of this show for me is that I want to engage listeners to learn ways they can help themselves. And one of the things I'm doing is I am working with bringing really fabulous, extremely knowledgeable doctors from Tenet, Florida Physician Services, thanks to David DePino, who is a wonderful, wonderful help to me. And he is the PR specialist for the group. And he always comes on the show, and usually he comes in right at the top of the show to give us a little bit of this breaking news that you'll find out about Tenet Health that's found out here before it's found out anywhere else. But because we have a very special guest today that can only be with me at the top half of the show, and I'm not gonna tell you that much about him because he's sitting right next to me, but I am gonna try to tell you that he is a sports medicine doctor. He specializes in orthopedic surgery and specifically focuses on specifically focuses on hips, on ankles, and feet. And the reason I said knees is because, ironically, on my way here, I'm a little bit frazzled because my son was on his way to his baseball game, and he hurt his knee in his football game. So I have the knee on the brain right now, but it's funny that I'm sitting here with a wonderful surgeon, an orthopedic surgeon at that, and he is and he can answer my questions, and I'm sure your questions as well. So I'm going to introduce, without further ado, this really fabulous doctor, Dr. Dominic Carrera.
Well
and that's the way I was told to pronounce his name. It's
well done.
Thank you. He's a Spaniard. But I'm also told that the way his patients remember his name is that he's Dr. Porsche Carrera. So he's the Mac Daddy of doctors, if you want to call him that. And he's sitting here with us right now, and I'm really excited that you're here.
Thanks very much. It's great to be here. Thanks for having me on the show.
Thank you. And so I'm just reading a little bit about you. You're obviously a very well-educated doctor. You work with Tenet's Florida Physician Services. And before we get into much more of the conversation, I just want to give out your information. You work at the Fort Lauderdale office?
That's correct. Yep.
And your telephone number is 954-764-2192?
Actually, 954-792-1010.
Okay. Say that again.
954-792-1010.
Can you tell our listeners exactly where your office is and how they'd get in touch with you through email or any other way?
Yeah, so the office is immediately off the expressway. It's at Broward and I-95. So actually you can see the building from I-95 off of Broward. It's just west of it. It's called the Strayer University building.
Okay. And if our listeners want to call in and talk to you right now, they would call it 888-565-1470. That's 888-565-1470. So one of the things I was reading about you, which I thought was really interesting, is that you actually were serving as an assistant team physician to the women's ski teams, the U.S. men's and women's ski teams, and
That's right.
the Colorado Rockies and Denver Broncos and the Chicago White Sox and the Chicago Blaze. So you've had a lot of experience with some tremendous athletes.
Yeah, I fortunately had a lot of exposure to sports growing up and being an athlete, as well as just through my training. So that was an important part, was in order to, I think, provide a high level of care. The stakes are high when you're treating professional athletes, and bringing those athletes to that level of care, bringing that is an important part, not only in training, but then carrying it forward in my career.
So So what exactly do you do that's different with an athlete than, let's say, a person who isn't a sports fanatic? So somebody like me, I play occasional sports, and I injured my knee as well. But I'm not an athlete. But somebody who plays for the Denver Broncos, their life depends upon their ability to play. So how would you treat that injury differently, or would you not treat that injury differently?
Well, I try and bring the same level of care to everyone. I think that understanding the stakes, when the stakes are higher, that I think over the lifespan of my career has encouraged me to be as detail-oriented as possible, because treating those patients as best you can is really not only what they expect, but what you want to give them. And so I think that level of detail, excellence in care, world-class type of medicine is a real important part of treating professional athletes. And then also, I think the communication and the expectations are different when you're dealing with all sorts of different people, from somebody who has a sedentary lifestyle to a professional athlete who's trying to get back on the field. Timing to return to sport, to being able to do what they want to do in their lifetimes is real important. And then also, I think there's in professional athletes, you're thinking of them as people and not only as athletes, in terms of saying, these are my concerns for you getting back on the field, but also concerns for a lifelong ability to stay active, comfortable, pain-free, participating in sports too after their career is over.
So when you're treating an injury, does it also depend on age? So, for instance, because I guess as you get older, I don't know about ankle injuries or foot injuries specifically, but I know with knees, because I had a knee injury, there's cartilage issues that I guess you start to lose cartilage, and
Sure.
just the whole thing is different. So maybe you can explain to me, somebody trips, they fall, they injure their ankle. How is that? How can they help themselves? And at what point do they say, you know what? This is just an ice job. This is a Dr. Carrera job.
Yes. So, and depending on the injury, they're all a little different. But specifically with ankle injuries, and very importantly with twisting type of injuries to the ankle, there are certain things that really help guide. And it's actually was done in Canadian medicine to guide whether a patient should get medical attention, and then specifically what type of care they should get when they get medical attention. So in the case of a twisting injury to the ankle, being able to bear weight, so being able to actually put your weight on the foot comfortably or not, is a guide. If you're not able to put weight down on your foot, meaning you're limping significantly, that's a guide to go get x-rays, get medical attention. Another thing that's really helpful in ankle injuries is whether there's pain directly over the bone. So you can, the bones of the ankle are pretty much right under the skin. So you can actually feel the bone, and if the bone itself is hurting, that becomes more concerning for having an ankle fracture, a broken ankle. And in that scenario, going to the emergency room, getting x-rays, and making sure that there isn't anything more serious that's occurred is helpful. Other things that are pretty common sense but really do help guide are extent of swelling. If the ankle really blows up, it's just really severely swollen, that's certainly a worse sign. And then the other thing that I think really helps too is just black and blue bruising and lack of improvement. If 3 or 4 days after an injury you're not seeing gains, you're not seeing improvement, that's more concerning for a bigger problem.
Now, is that the same for your foot or your hip? All across the board, to look for the same thing, or depending on the body part, the severity of the injury would be different when delineating whether or not to seek emergency?
Sure. Yeah, and the types of injuries are different from one body area to the next. So, for example, in the hip, I tend to see more slow onset type of symptoms, symptoms that occur when somebody's participating in sports, for example, but it doesn't come on all of a sudden. It didn't happen because of a single injury. It's more of I've been playing sports and my hip started hurting and it's just not getting better. It's been 2 months and I thought it was going to get better and it's not. So that's when they're typically seeking care. The ankle injuries related to sport are typically more acute, meaning they've happened because of something that happened on the field or because of a competition. And then it also holds true for non-athletes, meaning it's not just that we see that in athletes in the hip. Typically, again, it's slow onset, starts bothering them when the prolonged driving, just being on their feet for long periods of time, symptoms come on in the same fashion.
So, okay, these are great descriptions. I'm sure very, very helpful to me as a mom, and I'm sure helpful to a lot of people out there who don't know exactly when it's an emergency and don't want to run to the ER for every little thing that happens. But I want to get into a little bit about the background of you as a doctor and some of your passions and the things that you really enjoy doing. For instance, I do notice that, besides working with some celebrities and sports people, you also do a lot of work with Nova, with young kids and college kids. And so I think that's really cool. And it must be lots of fun to be over at the campus. I don't know if you're going to the campus, but that's kind of a fun thing to do.
It is, yeah. I mean, treating college athletes is a treat. They're motivated to play.
Like
they really
that, treating athletes is a treat.
Yeah, and they really love playing at the collegiate level, and even more so at the high school level. They just love playing their sport. And college, there's a little more maturity that goes along with it. So having a discussion that is more based on their health, they kind of understand it more. High school athletes just really want to play.
Right. And my age. My kids are 9 and 10, so they're just crazy. They want to go soccer, football, back to back. And, I guess this leads me not to just cut you off, but just to move it a little bit forward, leads me into how much is too much for a kid every day. Like a parent, if their kids are doing 3 sports a day or 3 sports within an hour, should they not go from soccer to basketball to baseball? Or is it okay to do that? Or at some point do you say, are you doing too much and that's why you're going to weaken the bone? Or is it actually strengthening the muscle around the bone?
There's definitely chronic overuse injuries. And particularly over time, there's been an emphasis towards single sport dedication, and especially in younger kids at an earlier age. And we do see more injuries in that setting where it's one sport all year round, many hours a week. We know that that there's more risk of injury in those athletes. Interestingly, too, there's evidence that being dedicated to a single sport doesn't necessarily make you more likely to become an elite athlete.
Interesting.
And so there's a fear oftentimes in parents, even at a young age, as kids get more subspecialized in their sport or dedicated to one thing, that they're not going to be able to make it. And evidence to date tells us that actually multi-sport athletes tend to make it to the elite level more easily. And it may be because of injury. It may be because of the fact that they don't get burned out by it psychologically because they've participated in different sports and have enjoyed different things at different points in their life.
They're not becoming obsessed. And, yay, because I'm a mommy. And, that's one of my biggest guilty pleasures because my kids were like, soccer, 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 ice hockey, ice hockey. It's like they kept switching from what they wanted to do. And I kept on having the arguments with people in my life that are like, well, if you really want them to get that scholarship, you need to focus, focus, focus. And I thought, these are kids. They need to try everything. They need to do everything. They need to learn everything, and they need to excel in as many things as they can. So I'm so glad to hear, and I'm sure a lot of our listeners are glad to hear, that they don't need to obsess and push that kid to be on that horse or be on that soccer field or be in that baseball field. And the kids can be kids, and they can just sort of play a little bit of everything, which is what my kids are doing. They're doing ice hockey. Well, they were doing ice hockey. That became a little bit expensive, but they're doing, football, and they're doing baseball, and they're doing swimming and, basketball. So,
yeah, that's great.
They love all the sports and they excel in a lot of the sports, but they're not necessarily the top athlete in all of the sports, but they're doing them all. So it brings me back to my question. I know being diverse is great, but how many sports within a couple of hours is great? Like, can you go from basketball to football to tennis? Or should you take an hour break or a 2-hour break? Or is the car ride from one place to the next break enough?
Yeah, I think it really depends on the situation. In South Florida, the timing of the year is important. Certainly dehydration, the heat, and then the type of sport in which you're participating are really important factors to bring into consideration. for example, in high school football, the pads are on, the helmet. The concerns with heat are real, and so the dehydration. I mean, I certainly wouldn't want to see a high school athlete playing football in August and then going to play soccer afterwards, or go do something aggressive after that, because there's a lot of heat-related illness.
But that's
also
dehydration. But what about physical illness?
Yeah, it's really based mostly on time, meaning how aggressive are you with that one particular activity. So for a baseball player, a pitch count really helps to limit the stress on the arm. For a runner, the distances, just looking at it and at what you're doing in that individual sport. And if you were to cross-train, so if you have an athlete who plays soccer and then they swim, the likelihood of being able to do both sports is much higher. I mean, they're much less likely to have an overuse injury because they're using different body parts.
So my son loves to claim he's the fastest runner in his grade. Yeah. He just loves to run. He's just this speedy little thing. And now he's devastated because he has this knee injury. Just as a doctor, giving advice to people out there, first of all, how long should you wait to stay off your feet when you have an injury? And no pun intended with the feet, but because I know you're a foot doctor.
Sure.
When you have an athlete who loves to run and he's passionate for running, I mean, that's probably one of your biggest patients, right? Are people that love to run. And are there special shoes that you recommend that can help them become a better athlete, that can protect their feet? I mean, I know for me, and I don't know if you do bunion surgeries. Is that part of what you do? Yep. I have had, since I gave birth to my son, I had a bunion. And I know it had to do with maybe all that weight and my foot flattening out. And it's also hereditary, but extremely painful. I have stopped wearing pretty shoes 10 years ago already. I just can't wear them. But I've heard that's the worst, scariest, most painful surgery almost in the body. And the thought of that, I don't know if there's truth to that, but I walk around not wearing pretty feet. Not wear pretty shoes, not feet. Wear pretty shoes because I don't want to go through that surgery.
Sure.
So maybe if I came to see you, Doc, you could figure out a way to save me that pain and get me in those pretty shoes again.
So bunions are painful. I think with modern medicine, the control with surgery is a lot better than it was even 10 or 15 years ago. So I think there's a big difference with that. I would say the patients that I operate on their bunions, the majority are well controlled in terms of their pain, the vast majority. So I tell them, if you're having a problem, call me. I'll help you to take care of the pain, regardless of the hour of the night. And I rarely get calls. So
is it a very painful procedure, like people say? Is there some reason that particular procedure is more painful than others?
I do think it is, in that if it weren't controlled, meaning I use regional blocks, which is a way of anesthetizing the whole foot and ankle from an injection behind the knee. And that typically works anywhere from 12 to 24 hours. And so in that first day, if it's really the most painful. And if you did not have a block like that, I think it really is very painful and requires narcotics to keep it under control. But I think with that change in the way that we handle it, and even sometimes I'll use a longer acting block, that pain stays under control.
Interesting, because I don't like drugs. Like, I'm just that person. I won't take those kind of things. I'm more of a holistic person. So, maybe you're going to convince me into coming to see you, Doc. The Porsche Mac Daddy of doctors, and to finally get me back in my pretty sexy shoes again. I've also been concerned as a person who has to drive. You have the right foot, and it's a right foot, problem. So what would you do? I mean, how long can you go without driving? And that's a concern, I think, for many people.
The directions related to driving are not very specific. And that is, there's really two main concerns with it. One is a medical concern, which is that as the bone's healing in a bunion surgery, the bone is typically cut and shifted and aligned well. So as that bone's healing, the use of the foot may be more limited or less limited depending on who you are, your pain tolerance.
Which mine is 0, by the way.
So, and those are things I talk about.
Zero pain tolerance, but won't take pain medication.
Yeah,
Go figure.
That's a tough patient to take care of.
I am trouble,
yes. So that's one thing. And then there's also a legal part of it, I think, which is that if it's your right foot and you're driving, I tell patients, if you get in an accident and even if it's not your fault, somebody says, well, why are you driving? You had surgery on your foot a month ago. And we don't have any clear guidelines because patients' ability or people's ability to drive varies so much across individuals. I mean, there's probably some people who with a broken foot will be able to drive better than others who have a foot that's perfectly functioning.
But drive when? Are we saying a week? 6 months?
A little bit depends on the surgery, but probably about 2 weeks.
Oh, that's not as bad as I thought, actually. Interesting. So what's the healing process from start to finish, I guess?
So the majority of the healing occurs in the first 6 weeks. Most bunion surgeries, I allow patients to weight bear or to walk on it right away in a special shoe. So they wear a shoe that has a big heel. And what essentially it does is it takes the pressure off the front of the foot and transfers it to the back of the foot. And so that keeps the pressure off the area that's been surgically treated. After 6 weeks, I generally start transitioning into a sneaker-like shoe. And in the first 6 weeks, it's simple daily living activities. So not walking the mall, not going to Target, not going to the parades.
I don't want to hear that.
Stuff.
I want to know when I can get sexy, hot, high heels back on my feet.
Oh, boy. All right. So that's probably...
Let's get to the chase there.
All right. Two things with that. One is probably 3 months to being able to get into heels. The other part of it is that high heels contribute to bunions. So I tell patients that if you are going to get back into a high heel or a higher heel, they're all relative based on the height of the heel, then you're more likely to have a recurrence or that it'll come back. But the shape of the front of the shoe is real important too. It's not just whether you're in a heel. If that shoe is squeezing your foot, particularly towards the tip, it really forces the big toe to come over because that's the only way the shoe allows.
You're making me sad, Doc. So, from what I'm hearing is I'm never going to really wear my sexy shoes again, or I just can keep on seeing you, and you can keep on doing surgery, which is great for your business. Yeah. So, speaking of shoes and feet and injuries, it looks like we have a caller on the line that wants to speak to you. I think Peter's on the line. Are you there, Peter?
Yes, hello.
Hi, Peter.
Hello, Peter.
How are you?
You have a question for the doctor?
Yes. The other day, actually, I was playing around with my younger daughter, and I jumped, and I guess my heel hurts.
I'm sorry, I missed
Can
that.
you talk into your phone again a little bit, please?
Yesterday, during the weekend, I was running with my daughter, and I went to jump off of a little area, and my foot hit the ground hard. My heel kind of hurts.
Okay. So I'd like to just get a little more info on that. So when you hit the ground, did your foot hit flat on the ground? Meaning, did it twist or did it just hit the ground?
No, I felt like I sprained it. But
it felt like you sprained, like you twisted it.
Yeah.
Sorry to hear that.
I'm sorry to hear that, yeah. So, and then how high did you jump, and what did you hit? What kind of ground did you hit? Was it on grass? Was it on concrete?
It was on grass, and it was probably around 5 feet.
5 feet, okay. And the pain that you're experiencing now, where would you say it's mostly? Meaning, is it on the bottom of the heel? Is it the back of the heel? Is it around your ankle?
Well, there's no pain until I go to step on it. And then when I step on it, it's almost like the whole back side of the actual heel itself. And it also hurts, like, when you move your foot left to right, on the left side, it makes a little shocking going up the ankle part.
Okay. And which foot is this?
The left.
The left side. Okay. Yeah, so and it actually twisted as you were when you hit the ground, the ankle rolled.
It felt like that, but I don't remember exactly what happened. I just know that when I kept trying to run, I couldn't. It was like more of a limp.
Okay. Got it. So there's two main things I would think about. One would be just a classic ankle sprain, which is a twisting type of an injury, and common things being common. There's a good probability that would be it. And right. The ankle sprains will can hurt towards the back of the ankle area and what we call the hind foot or the back of the foot. So that would be a possibility. The other would be that you have a bruise of your heel bone. So as you hit the ground coming from 5 feet up, that impact can actually cause the bone itself to get bruised. It's like a bruise on your arm where you get swelling on your skin and deep to the skin, and what we call the soft tissues. The same thing can happen in the bone, where the bone reacts by getting edema or swelling inside the bone, and then it just hurts. It hurts, especially when you put weight on it, but it can also hurt some at rest.
So what can Peter do, Doc? Does he have to come see you for something like this, or can he self-treat?
Yeah, so I'm sorry, you said it was how long ago?
2 days ago.
2 days ago. Yeah, so, it's a bit of it is a judgment call over the phone. I think it helps to, to see these things, to make a call, but the inability to bear weight. So if you really can't put weight on it, especially over the next day or two, then I think that is a sign that you really, that it would be a good idea to get it checked out. And that would probably be my number one recommendation. The other thing is just getting a sense of swelling. So if you feel like your swelling is just getting worse, it looks like, really swollen, then it would prompt me to get some medical advice sooner than later.
Now, can he wrap it, like go to the drugstore and get some sort of an ankle wrap to help protect it?
So then you have this acronym, which is called RICE, Rest, Ice, Compression, Elevation.
I love that. RICE. We'll put that up on our website.
Never forget it.
Say it again for us.
RICE is Rest, Ice, Compression, Elevation. So for most orthopedic injuries, that applies. The rest part of it is just backing off on activity, avoiding pain. Ice, we generally say you can do 15 minutes on, 15 minutes off, giving it the ice, the main thing that it helps with, not only with pain, but with the inflammation associated with the injury. Then you have compression, which is essentially what a wrap is, like an ACE wrap. You can do a 4-inch or a 6-inch ACE wrap. You can pick those up at the pharmacy. You want to make that wrap snug. It doesn't have to be tight and painful, but snug will allow it to minimize swelling. Swelling in itself can cause some pain and a sensation of tightness, and that helps. Right. And then the last is elevation. Depending on the body part, that applies more or less. If you have a hip injury, you can't really elevate it.
That'd be an interesting sight.
Yeah, other than laying down is relative elevation. But like in the case of an ankle or a foot or a knee, propping it up, putting it up on pillows, just keeping it off your foot, not having it hang down to the ground, putting it up on a chair if you go to school, put it on a chair if you go to work. Throw it up on top of your desk or put it in a chair next to you. Those are little things that can help to minimize the swelling.
That keeps the blood flowing through?
Yeah, it helps with blood flow, particularly returning to your heart. And it just helps with pain, especially early on. The more swollen it gets, the more painful it tends to get.
And what about taking Advils or ibuprofen? I mean, do you recommend things like that to help the swelling come down?
Yeah. So any of what we call the nonsteroidal anti-inflammatories, which are Aleve, Advil, then the prescription ones are like Celebrex, Mobic is another one. All of those are medications that really treat inflammation. And so those are helpful to treat any sort of inflammation. So from any trauma, chronic pain, those things tend to be helpful.
So can you give our caller, Peter, your address and telephone number if he wants to get in touch with you and follow up?
Sure. Our address is 2307 West Broward Boulevard, Suite 200, and the phone number is 954-792-1010.
And I can tell you, caller, this particular doctor is a sports specialist, works with athletes regularly. So if you're an athlete and you're looking for a top-notch doctor who is a surgeon or just somebody to take a look at it, you don't just necessarily see people because it's surgical related, right? You see just regular patients.
Sure.
So if you want to do a follow-up with him, that's the whole point of this show, is that people can have access to fabulous doctors and that they may not have known about, and now they're hearing about it on this show, and they can get quick advice and then maybe come in and have a follow-up.
Perfect. Thank you.
You're welcome.
Thank you for calling, Peter.
Thank you.
All right.
So, all right, moving on, doctor, because I know that I don't have you for, actually it's 7:30. I don't know if I can catch you for 5 more minutes.
Sure, 5 minutes.
Okay, because I know the doctor has to leave, and I should have taken a few commercial breaks, but I'm having so much fun listening to him. I wanted to hear something about this company or this program that you're affiliated with called MASH, and in my mind that's Dr. Hawkeye. If I date myself, I'm going way back to the days of MASH, but I know it means it's an acronym for something else, And I kind of want you to explain it to our listeners and what it is and what you're involved in and how that can help people.
Sure. So MASH was, it happened to be a catchy name, but what it really stands for, and I'm saying catchy just because of the great show that MASH was, but a multi-center arthroscopy study of the hip. So there's a change in medicine in that we're now able, really through software development, to be able to track patient outcomes. It's become a lot easier than when I was a student, for example, to participate in research. And in this case, this is really the only major ongoing research multi-center study in minimally invasive surgery of the hip that's going on now in the United States. And I helped found it with a group of fellow hip arthroscopists who were interested in getting better data, basically, to be able to answer difficult questions that we have related to hip injuries. And one of the challenges in doing research is having enough statistical power, or having enough patients to be able to make a result, to make a conclusion, because of
or a smart
the variability.
decision, right? I mean, that's kind of the whole point, is that you need these research patients to be able to help you improve the industry.
Sure. And the problem is that a single surgeon experience, so one surgeon can collect all their data, but you can't answer a lot of the questions with just one surgeon's information. So what we've done is there's a group of about 10 of us, and we agreed upon all the data points that we were going to collect in order to try and answer these difficult questions. And we collaborate. We share our data amongst ourselves in a de-identified way, meaning that patient information itself isn't shared. It's patient information without being identified. And with that, we're just actually, it takes a lot of work, a lot of setup. It's been a couple of years, but right now we're really just starting to participate in presenting this data and actually publishing it moving forward.
So I have two quick follow-up questions before I let you go pertaining to this. Number one, I think it's great. Obviously, in Florida, you get a lot of hip injuries, specifically with the elderly community. You know, they walk, they fall, they break their hip. I mean, I know that's fairly common if I'm correct. Is that sort of the area of study that that age-related study that you're doing, or is it?
Sure.
Is that why it's here in Florida?
This is it's actually more for the non-arthritic. So patients who don't have arthritis. That generally means it's a younger population. So it's a hip preservation procedure as opposed to the joint replacement procedure. And so my average age is about 35 for surgical treatment. And it's basically patients who have chronic pain of their hips, who have permanent injuries inside the hip joint that can be treated via arthroscopy.
So what would have caused like a permanent injury? Is it a car accident, or is it a sports-related injury? Like, what specifically causes somebody to have that kind of hip problem?
Sure. The majority of patients have just slow onset of pain. There's not a particular injury that leads to it. One of the things that's been identified in the last 10 years or so is a problem called impingement, or femoroacetabular impingement. And essentially what that means is that the shape of the hip joint is abnormal in a way that causes abnormal forces across the joint mechanically and contributes to joint damage. So it's considered an associated factor. It's not a true cause and effect, but that bone alignment can contribute to joint injuries. So one of the ways that we've seen that, or that it's been well shown, is, for example, in athletes, and particularly contact athletes, tend to have femoroacetabular impingement more often than non-contact athletes.
I wouldn't even attempt to say that word, by the way. Can you say it for me again slowly?
Yeah, the femoroacetabular impingement.
Femoral?
Femoro means the bottom bone of the hip joint. Acetabular is the top bone of the hip joint. And then impingement means abnormal force between two objects. So
I had an injury when I was younger, a slip sacroiliac joint. That's the hip, isn't that?
Yep. It's the joint and back of the hip joint. So yes, it's considered one of the pelvic joints. Oftentimes one of the hip joints is considered, yes.
Okay, so I know you have to go, so I'm just going to ask you to tell our listeners your telephone number, your address, your website, and how they can find out more about this MASH, and if they want to participate in this research and
Sure.
join the study or get in contact with you, it would be great for them to know.
Thanks very much. Appreciate it. So the website, we have a Florida Institute of Orthopedic Surgical Specialists, and that's F as in Frank, IOSS, .com. My personal website is hipfootankle.com. So that's easy to remember. And then the MASH study group is mashstudy.com. The MASH study is a multi-center study, so it's really you can look at it and see there's surgeons from top centers all across the country.
And Dr. Carrera?
Good.
Carrera, or the Porsche Carrera of Mac Daddy orthopedic surgeons, as we like to call him here at Stay Alive and Fit. To get in touch with him is 954
792-1010.
And I have to ask that and kick it to him only because your website needs some updating there, Don.
Okay, thank you.
And we don't want anyone to make a mistake, so let me have you say it one last time for us.
954-792-1010.
And what was the acronym? REST acronym? For?
RICE. Rest, ice, compression, elevation.
Rest, ice, compression, elevation.
You got it.
So we're about to go into another acronym when we come back from the break, which is called slip, slop, slap, and wrap. And that's what the American Cancer Society would like you to remember when you are thinking about how to protect your skin from melanoma this summer and any time of year. Remember, slip, slop, slap, and wrap. And we're going to kick it to a break and say thank you so much for Dr. Carrera for coming into the show. And we are really, really appreciative of his information. And thank you to our caller, Peter, who did exactly what this show is all about, which is to call in and participate and get the answers you seek right now. Don't have to wait for a doctor's office to open. Don't have to wait for approvals. Just get your answers, get quick advice, and if you have to or want to and you want to email us and come in and see the doctor here on our show live, we can get you some special treatment right here in our studio. So give us a call and tap into our website at www.stayaliveandfit.com and watch us live on amp2.tv. That's A-M for Mary, P for Peter, the number 2.tv, and call us at 888-565-1470 and participate. We'll be right back.
After the break, our healthy hot topic of the week. Stay tuned to AM 1470 WNN. You're listening to Stay Alive and Fit with Liz Goodman. With Obamacare, it's almost impossible to get comprehensive medical care and information. What if you want to see an acupuncturist or chiropractor? No way, they won't pay. Need a specialist without waiting 3 weeks for a referral? Ask Liz. She provides VIP medical information for the masses. No referral, no marketplace, no hassle. Get on board and stay alive and fit with Liz Goodman. Mondays, 7 p.m. or watch live on amp2.tv and like us on Facebook.
Oh, I'm so bad at that. I don't even know why I do it. Hi, and welcome back to Stay Alive and Fit. This is your answer to getting fit, healthy, fabulous, and just feeling great. And I'm a little bit tongue-twisted today because I am a little bit concerned about my own son who's sitting home with a knee injury right now. And I'm so grateful and thankful to the doctor who was here and gave me a little bit of advice. And I appreciate our caller. But I want to get to one of the things that we are supposed to be talking about this month, which is melanoma. This is Melanoma Monday, and very important information. We were expecting a call in from Dr. Casey Cohen, but she had an emergency and she couldn't call in. And if you remember her, she was a guest on the show a couple of weeks ago. She's our oncologist and our melanoma expert, and she promises to be with us in the next couple of weeks to give you some more fabulous tips and something we're going to call Casey Tips. So tune in for Casey's Tips. And in the meantime, I have some information from the American Cancer Society that was sent to me today by a gentleman by the name of Chris Snyder. He said he's going to be dialing in and calling me in a few minutes to get on the line and tell us all the important things that we need to know directly from the American Cancer Society to help protect yourself. But I keep on saying the things, this acronym that you keep hearing, slip, slop, slap, and wrap. So I'm going to tell you a little bit about what that is. Slip, slop, slap, and wrap is slip on a shirt, which is cover up and protect yourself with clothing whenever you go out in the sun. Make sure it's comfortable and light-colored and lightweight. Slip on or slop on the sunscreen, which is using broad spectrum sunscreen with sun protector factor SPF of at least 30 or higher. And slap on a hat, really important to protect your face. I think that Chris is trying to dial in, but if you hold on up, I can hear my producer, Ken. He's telling me he's on the line. But I'm going to give you the last quick information, which is you're going to slap on sunscreen 20 to 30 minutes before going outdoors. And then keep repeating it every 2 hours. And then slap on a hat to make sure your face, neck, and ears are covered. And then don't forget the very important part, which is wrap on sunglasses. People always forget to protect their eyes. But eyes are very, very, very prone to getting cancer. So while I've got the expert on the line, which is Chris from the American Cancer Society, and I'm so grateful that he's called in. I want to welcome him to the show and see if he can give us any quick tips, because I know I'm interrupting his dinner for this call, to tell our listeners exactly what it is they need to hear and know to protect themselves every day living in South Florida from skin cancer and melanoma. Welcome, Chris.
Well, thank you, and good to be here this evening. I think you really hit the high points that folks need to know in order for, really a high level of prevention of all different types of skin cancer. And I think one of the takeaways that people should realize is melanoma early on can, be present and not even realized. And that said, then spread to another part of your body, which they use the term metastasis, right? And when you find that in another place, it could be, deadly. So it's good to catch it early, right? That's about the prevention and, the kind of the slogan that you just explained to your listeners, quite vividly. That really hits it on the T in order for prevention. But I'd say making sure you're getting those checkups and checking your moles and your markings and your freckles and looking for the discoloration, looking for the abnormalities that kind of come with that. And if folks need access to any of this information, they can call us 24/7, basically across the world by dialing 800-227-2345, and that's our National Cancer Information Line, which can provide more information, can provide more of the scientific data related to melanoma and different types of skin cancers. And then also let people know about access to care, access to treatment, if they are, in fact, experiencing this themselves or a family member. Maybe there's a caregiver listening. We have great resources for those types of people. And even if it's just questions, we're there to answer those as well.
Chris, you said something a few minutes ago that I actually didn't know, and many of our listeners may not know. I didn't realize melanoma can spread. Now, I know that you can get, a melanoma on your face or a skin cancer somewhere, but I didn't realize that it can actually metastasize into something else. I mean, I realized it could spread, but when you say metastasize, does that mean it can turn into a different type of cancer?
Yeah,
Is it like lymph node cancer, which actually goes into your lymph nodes and spreads and can end up in your liver?
And I'm not a scientist, so can't really speak on a lot of the scientific side of this. But what I do know, and from speaking with constituents and in the community, other doctors, is that depending on the type of skin cancer, absolutely it could spread to another part of the body and thus create, a different type of cancer, or cancer is going on at the same time. You're treating one to avoid the other, and those are some of the complications in this disease. Because it's more than one cancer. There's hundreds of cancers, and when we were looking at, like, for instance, leukemia, and I don't want to go off topic, but looking at that in the 80s, today I think we were looking at only a handful of forms of that during that time, and now we have over, I think, 90 different types. So that said, it's very sophisticated, and people If they have questions, of course, you consult their physicians and their doctors and so forth, and make sure they're checking their skin, and that requires an annual checkup in some cases, maybe 2 times a year. And that's a big part of what the American Cancer Society is there for, is that prevention and early detection part of, on top of the research that we're doing to help discover, cures to this disease. Just making sure that prevention is at the highest level, and using the right types of sunscreens, and having just a lot of awareness to your exposure and what you're wearing, and just the different elements that are in your surroundings.
So, Chris, can you do me a favor? Can you tell our listeners, if they want to donate to the American Cancer Society, do they delineate like a specific cancer that they want to donate to, or do they just donate specifically to the American Cancer Society, and therefore it's applied to all cancers?
That's a great question. What's unique about the American Cancer Society is our donors really can choose. They can pick a particular cancer that they're looking at. For instance, if it is skin cancer, they can designate a donation. They can call that 800 number I mentioned before, which is 1-800-ACS-2345, and that's simply 800-227-2345. And outside of that, if they want to make sure that it's going to their local branch, they can reach out to their local branch as well. For instance, my branch is in West Palm Beach, Florida. And we often have folks who call us, and maybe for a memorial and just memory of someone, where they can make that donation, and then we would send a kind letter to the family in honor of that individual. And there's many other ways to also include us in donation thoughts, and that what may be through one of our events, our local events like Relay for Life. Going out to your Relay for Life, having a team donating towards, your local event, or even a Making Strides Against Breast Cancer, which is another signature event of American Cancer Society, which is really geared towards programs and services local to every community across the nation, and those dollars and those communities help benefit those communities. So that's access to wigs, bras, prosthesis, caps, blankets, and then other critical information, maybe access to certain screenings or testings. So there's really great resources that can be found for that donation portion that we're talking about here at cancer.org as well.
Well, I want to thank you so much for coming on the show. I really appreciate it. And I'd like to invite you, if you have time this month, to stop on by the studio and come sit with me and talk to me, and we can get some listeners to call in, and maybe we can even arrange a time where I can do an event and speak at an event with you, or bring some of these fabulous doctors I'm working with at Tenet Florida Physician Services and coordinate a way that we can all work together on letting the public know how they can donate and help research when it comes to any kind of cancers, but specifically right now for this month, melanoma. Thank you so much, Chris, for your time. The number again is 888-227-2345. And what's the website address they should go to, Chris?
That number was actually 800.
Oh, I apologize.
227-2345, and the website is cancer.org. You can get answers to almost any cancer-related question.
Okay, so that's 800-227-2345. Thank you so much for calling in, Chris. Is there anything else you want to say before I know you have to hop back to your dinner?
No, Liz, but thank you for having me tonight. Also to the folks out there, I think it is important for that type of collaboration. So yes, indeed, I would like to partner with you more in the future, and work together with our physicians and our health systems here in not just Palm Beach County, but across the nation, to really help finish the fight and close the gap on cancer.
Okay, thank you so much, Chris. Enjoy your evening. We'll be in touch.
Thank you so much. Take care.
You're welcome. And so here's what I know I've been waiting to hear is, what is the breaking news? David DePino is sitting in the chair next to me, and I'm excited to hear. I hear you have some more information about AFib and some other really cool things to talk about. And we have about 10 minutes or 8 minutes left, so go roll with it, Dave.
Okay, yeah, I do have a lot about AFib, but since we're on the Melanoma Monday, observance today, I actually have a quote from Dr. Cohen that we got late today, and that we actually put on our Facebook page. It is a little lengthy, but I'd be glad to read it if you like.
I would love you to.
So Dr. Kimberly Cohen, she is our oncological surgeon or surgical oncologist and hepatopancreatic-biliary surgeon.
I love it when you say that.
For Tenet Florida Physician Services. And we asked her for a quote over the weekend, and Dr. Cohen's skin cancer quote for Melanoma Monday is, "Just behind that bronze summer tan and hiding beneath that rosy glow of the sun lies a deadly killer. The myth that tan people are healthy people couldn't be more deceiving. The truth of the matter is that the sun kills not only the youth of our skin, but it can also transform our skin into cancer. Melanoma may start on the surface, but can quickly travel to any area of the body. Many surgeons and physicians often refer to it as the ninja of cancers because its behavior is unpredictable. It remains a mystery in many respects, and it can hide anywhere, strike with deadly force, and even after many years of remission, resurface in a completely different location. Protect yourself from melanoma. Check your skin regularly, looking for changes in any moles that you may have. Always wear sunscreen higher than SPF 30. And don't forget about the lips, scalp, and ears. You do find anything worrisome or suspicious, if you do find anything worrisome or suspicious. Never use tanning salons. Stay out of the sun during peak hours, 10 a.m. to 2 p.m. And lastly, see a dermatologist if you do find anything worrisome or suspicious. A tan today may leave you with scars tomorrow. And that's from Dr. Casey Cohen.
Well, thank you, Dr. Cohen. I know she had planned on calling in tonight, but she had an emergency and couldn't do so. And as I've mentioned before, I have a little segment I want to add to the show, which is going to be periodic, but it's going to be called Casey Tips. We talked about it, and this is one of Casey's tips because she's really fabulous, and she's smart and knowledgeable, and she's one of our great doctors from Florida Physician Services. And thanks to David DePino, she graced us with our show and will grace us again in the future with our show. So, David, is there anything else that you want to tell us about?
Yeah, so last week we talked about the convergent procedure. That's where they attack atrial fibrillation from the outside. Cardiothoracic surgeon does the surgery from the outside on the heart. And then from the inside is that electrician of the heart. We talked about the cardiac electrophysiologist. I know these are big terms, but
You're great at saying them, though.
Lots of practice. I've practiced a long time. So the cardiac electrophysiologist attacks the AFib from the inside of the heart. And since telling you about that and telling your listeners about that, I've discovered that we have another procedure going on here in South Florida that is called the Watchman device. And why the Watchman device is so powerful and amazing is because they can actually shut off the left atrial appendage area of the heart. And that's the area that produces the blood clots that cause strokes. And I didn't know this last week.
Interesting.
And I wouldn't have been able to share this. But our Dr. Bridge Manny, he's an interventional cardiologist, and he's regional medical director of transcatheter therapies for Tenet, Florida, shared my information. He actually did a procedure today in Delray.
Do you think he might come on our show one day?
Oh, yeah. I'd love to have Dr. Manny on. He's a little busy right now because they've just started doing the Watchman procedures.
So this is a brand new procedure?
It was in, like we said last week, it was in clinical research for so many years. So it's a brand new procedure for Tenet, Florida. So something we're doing. So he's involved in over 60 trials right now.
Wow.
And I'm actually working on a clinical research press release with him on this and other topics. But it's amazing what they're doing nowadays. We talked last week about atrial fibrillation maybe just being annoying flutter in the chest, but it can also cause strokes. That's what we've learned today.
And as I had my father call in a couple of weeks ago when we had Dr. Velasquez, right? You know, he was talking at great length with him about his AFib and the fact that he had a stroke and he had a heart attack because he let it go too long. And with all these new procedures like this procedure you're mentioning, I mean, people who are afraid to have these procedures done so that they don't get these proactive procedures, so they don't end up with a heart attack or a stroke. It's fabulous to know that they can come here, they can see a doctor from Florida Physician Services, Tenet Florida Physician Services, who are doing these really great, life-altering and innovative procedures and reduce these risks. Like, this sounds like a fabulous procedure.
And like last week, we were talking about the convergent procedure lasting, many hours during the day, 6 to 10. This procedure only lasts an hour, but you are kept in they observe you for the next 24 hours, so you are kept in the hospital for a day.
And the other procedure, you got to leave, but it took all day, right? Is that how it was?
Yeah, it took longer, and I believe you're out for both of them. Yep, that's correct. You're out for both of them. But this one obviously is better for someone maybe older in age who can't or wouldn't be a great candidate for a long surgery. This would be better, because they're only under for the hour, and obviously it helps with stroke. And another thing I've found, talking to Dr. Manny, is the people who have to take warfarin medication, that's a blood thinning drug with potentially risk of stroke. After they have this procedure, they no longer have to take warfarin, and a lot of cardiologists would like their patients off warfarin. I've heard that many times, not just in Tenet, Florida, but around different hospital groups when we've had different physicians speak at like a symposium or that kind of thing. So that's two great things. I mean, it's a non-drug alternative.
So we have about 2 minutes left of the show. So do you want to give us a sneak peek as who's going to be on the show next week? Or
Yeah, I'm still working on getting Dr. Matthew Goodwin here. He's the plastic surgeon in this area, right off Yamato here in Federal at the Sanctuary.
Okay.
He's also at West Boca Medical Center, Good Samaritan Medical Center. And then also, obviously, Dr. Bridge Manny, we want to have on that we were talking about, does the Watchman device, working on having the electrician of the heart in the future. Obviously, this is very heart-focused lately.
Right.
But another big thing is, May is Better Sleep Month. And we have a sleep specialist that I'm trying to bring over to speak on, why is it important to get a good night's sleep, the ways sleeping can hurt you, if you're not sleeping the right way, and with the heart.
I have to wrap you up. I'm so sorry, David, because I've got 1 minute left. It's always a pleasure having you here. I'm going to try to get you on sooner. Thank you so much for my guest tonight, Dr. Carrera, and also for the quick tip from Casey. I appreciate that. Thank you to David DePino. Thank you for our call-in, Peter, and also for our call-in, Chris from the American Cancer Society. You can watch us live on amp2.tv. You can call in at 888-565-1470. And please link to our Facebook page and at www.stayaliveandfit.com. Send us an email at liz@stayaliveandfit.com. Ask us your questions, call in and participate. We're here to help you. Until next week, see you later, guys.
You've been listening to Stay Alive and Fit with Liz Goodman, a new innovative radio show that taps into what's happening now in the medical industry, featuring fitness experts, foodies, and medical professionals from Tenet Health, with breaking medical news from David DePino. Get it right here and be an active participant in your health. Mixed messages about what is best for your health can make you feel like you're on a runaway train. Get ready to hop aboard again next time for Stay Alive and Fit with Liz Goodman. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.